guys, welcome to my YouTube channel. My name is Agbola Adedoyin. See you at Desi_collections. This is my first YouTube video, so please like, follow, and also turn the notification bell on to keep you updated. So I'll be talking about a topic I titled Pregnancy/Parenthood. I believe we all have different understanding to what pregnancy is or could be. For me, pregnancy occurs when a sperm fertilizes an egg. Do we get it now? Pregnancy occurs when a sperm fertilizes an egg and it's being released from the ovary during our ovulation. Yes, an egg is being released from us during our ovulation, which by the time a sperm comes in at that moment, we have what we called pregnancy. Pregnancy occurs when a sperm fertilizes an egg after it's been released from the ovary during ovulation. The fertilized egg travels down into the uterus, that's our womb, where the implantation occurs. You get? So a successful implantation results in pregnancy. A successful implantation results in pregnancy. A successful sperm meeting an egg at that moment, at that time, results in pregnancy. On average, a full-time pregnancy lasts 40 weeks. Now, I'm not saying all pregnancy lasts 40 weeks. No, we have some pregnancy that lasts from 38 weeks, some 37, 39, 40, 41 weeks, thereabout. But on an average, a full-time pregnancy lasts 40 weeks. Now, there are many factors that can affect a successful pregnancy. One, an early pregnancy test and a prenatal registration would successfully back up a pregnancy to term. Would successfully back up a pregnancy to term. Knowing what to expect during the full-time pregnancy is important for monitoring both for your health and the health of the baby. So that is why I said a prenatal care, an early prenatal care registration, do you understand, also helps with a successful pregnancy to term. If you would like to prevent pregnancy, there are also effective methods you could also use in controlling pregnancy and all. Well, we are actually not on that today. Now, there are symptoms of pregnancy. The symptoms of pregnancy comes differently for everybody. We are not the same individually. Yes, we respond to issues or to things differently. So the symptoms I may have while being pregnant is not the same symptoms I'm expecting you to have. But I'll just list or give us a general symptoms I believe one or two can experience while pregnant. You notice some signs and symptoms before you even take a pregnancy test. Other symptoms follow up weeks later, and also as your hormonal levels change. Yeah. So now we have the symptoms of pregnancy. We have a missed period. A missed period is one of the earliest symptoms of pregnancy, and maybe the most classic one. However, a missed period also does not necessarily mean you're pregnant, especially if you have a regular cycle. Like if you have a regular period, if you also are not sure of your menstruation last month, you're not sure of your menstruation last month, you're not sure of the date the previous one came earlier. So that is in regular period, in regular menstruation. So you can't, or you such person can not necessarily say I'm pregnant. Do we get it? But like I said, it's one of the, let's say, the most classic one everybody experienced. Like, okay, I've missed my period, maybe I'm pregnant. Any health conditions other than pregnancy that could cause a late or missed period, but that's not a topic for us to discuss today. I'm sure we're gonna come back to that some other time. Secondly, now we have headache. Headache are common in early pregnancy also, usually caused by increased blood volume. So please consult your doctor if your headache are painful or does not go away. Please, it's not something for you to take for granted, or it's not something for you to joke about. Once you've taken the paracetamol and you've had enough rest and the headache is persistent, please consult your doctor. Don't see it like it will go on its own. Just consult your doctor for more explanation, for more experience and all. That is why I said, or that is where the early prenatal registration comes in. So you don't just sit back at home doing self-medication for yourself. Do we get? Please, I believe we're getting along as well. So please, if your headache doesn't go away, or if you're having a painful headache, please and please consult your doctor. So some women experience light bleeding or spotting during pregnancy, and this is often the result of the implantation, which occurs 2 to 3 weeks after fertilization of the sperm. After the sperm fertilizes the egg, and so spotting may happen maybe 2 weeks, 3 weeks thereabouts. But also, spotting can also signal a serious, complication, pregnancy complication. Yes, spotting can also, signal a serious pregnancy complications. It could be a miscarriage. It could be a ectopic pregnancy. It could be some other thing like that. So, still, if the spotting is not, doesn't stop, and the bleeding is getting heavier and much, consult your doctor. Consult your midwife. You could consult your doctor, talk to your nurse, talk to your midwife, tell them what you're going through, tell them what your challenge is at that moment, and let them get to talk to you, let them get to tell you what to do. If you're told to come to the hospital, please don't sit back at home and feel reluctant or listen to our grandparents that has actually done that and all. It's better and more advisable you rush down to the clinic. Another one we have is weight gain. Yes, weight gain. You can expect to gain some few weights or thereabouts in your first few months of pregnancy. But yeah, it's become more noticeable, in the second trimester, because then the baby bump is, it's coming out, and the flaunting of, oh, I'm gonna become a mom, it's all there and all. So yeah, it's always more visible though in second trimester. Yeah. Pregnancy-induced hypertension. So high blood pressure, hypertension sometimes occur during pregnancy, and there are also many factors that could increase your risk of experiencing that, being overweight, smoking, and the likes of it also. Because I know we have some of our mothers who will tell you, oh, I've never had BP in my entire life. Yes, none, it doesn't even happen in my generation. But when I was pregnant of my firstborn, secondborn, thirdborn, thereabouts, this actually happened, and I don't know where it's coming from. Yes, it happens. It's not a village people here. It happens though. So it's something that also can be controlled while you're pregnant. Another one we have is heartburn. Heartburn, yeah. So pregnancy, what's it called? The hormones released in our body while we're pregnant, sometimes cause this heartburn for us. There's a leakage, sometimes when there's a leakage of acid from our stomach, you understand, because of the hormones, that everything is just coming, everything you've never experienced before because of the pregnancy. You have different things coming. You have different, oh, I want to vomit, I want to throw up, I feel sleepy, this, that. So those hormones sometimes cause, leakage from our stomachs, and that actually cause heartburn for us. So when you experience that, it is still part and normal for the pregnancy journey and constipation. Just like I've said previously before, the hormonal change we experience also can slow down our digestive system. Yes, during pregnancy, and so thereby you get constipated easily. Even if it's common fruits you have, you're just going to get constipated, like it's not digesting and whole. It is normal. It will pass. Yes, the time for it will pass. At a point will come, you no longer experience those things. But the fact that it's still an early pregnancy, you're likely to also experience that. Okay, so we also have cramps. As the muscles in our womb, in our uterus, expand, trying to make room for the newborn, trying to make room for our baby. So as it expanded, as it expand and stretch, well, you might feel a pulling like menstrual cramps. And some might actually experience bleeding, spotting, but please, it could also be meaning it could also be meaning danger. Yeah, let me use that word. It could also be meaning danger. So please, you should also consult your doctor. It could be an ectopic pregnancy, it could be a miscarriage. Do you understand? So please, if you have the menstrual cramp and there's a spotting, there's bleeding, you could please consult your doctor. So another one we have is back pain. The hormones, stress and all on our bones, on our hip bone, thereabouts, down there, could cause us also to experience a major back pain. I believe about an average of all pregnant women actually go through or experience the back pain thing, especially as the pregnancy continues to grow. You're gonna be whole and my back, and those pains and all like that. Yes, I can say it's still part of the pregnancy journey. It's just that you could bear it and also consult your doctor, talk to him about it. There are some exercise, like a basic exercise that are not tedious for you to do, that could relieve the back pain. So we also have anemia. Pregnant women have an increased risk of anemia, which cause lightheadedness, dizziness, thereabouts. So prenatal care, usually involves tests for anemia. So if there is any reason for it, I'm sure your doctor would place you on drugs. You understand, on drugs, on fruits, on foods that you can actually eat, and that could actually help you boost boost your immune system, boost your blood. Depression. About 14 to 23% of all pregnant women actually go through depression. Yes, it's real. It's not easy. The emotional change that comes with pregnancy. Whew, no, it's not funny. Yes, so please be sure to talk to your doctor or your husband or your partner or your mom or anyone you just feel you're comfortable with. You could talk to in the family, especially if you don't feel like yourself. Yes, you don't have to carry it all alone. You don't have to add that to the journey. The journey is already there. It's already, I can't say it's tedious, I can't say it's strenuous, but you don't have to actually have that burden of depression all by yourself to it again. So you could actually talk to your doctor, talk to your nurse, talk to your midwife, talk to your husband, talk to your friends, talk to your family, people you feel or you can trust, you feel comfortable around them, especially if you're not feeling like yourself. So you just need to talk to somebody, let them know how you feel, let them know what you're going through. Yes, don't just keep it to yourself. Don't just feel like I can enjoy it all. Everybody understands and everybody knows the journey is not an easy one. So you talking to somebody would not cause you harm. Or you talking to your doctor, don't worry, call him. He can't tell you while is too much. He also understand because that's why he's there. That's his job, so you have to talk to him. You can always call him on phone, just let him know, hey doc, I don't feel good. Another one we have is breast change, the changes in our breast. If you had the low or the small breast kind of person before, yes, pregnancy can actually make you a big ball person. There's this tenderness, you feel the hand and your boobs feel heavy, tender. Even if you wear bra, you feel like, oh, what's this? So pregnancy also affects that, and with time the whole heaviness, the whole heaviness anyway will all subside and you'll be your normal self again. Please, if you enjoyed this video, give it a thumbs up, like, follow, and also leave your comment, leave your suggestion for me in the comments section, so that we can know how to do better, or the topic you would also want us to discuss. Yes, I'm sure we haven't come to an end of this, but we'll see you next week. Take care. Mwah. I love you all. Bye.